I'm going to be talking about juvenile rheumatoid arthritis. It is also called juvenile idiopathic arthritis, or JIA. 1 out of 1,000 kids roughly has it, and that's about 300,000 children in the USA that suffer with some form of JRA. There are 3 types of JRA: polyarticular, polyarticular, and systemic. My daughter, who is 5 and a half, has the polyarticular, which is 4 or less joints. She roughly, right now, has 1 joint, but has had up to 4 joints at one time. It affects roughly 50% of all children that have JRA, and it usually affects the weight-bearing joints, the knees, ankles, the hips, like that. Katie has had her ankles and her knees affected by the arthritis. It usually only affects 1 joint on one side of the body, but for some reason Katie's has affected both knees and both ankles. It can also cause iridocyclitis, which is eye inflammation. She has to go see an eye doctor once every 6 months because she tested negative for the rheumatic factor, which will means she's got a higher chance of having the swelling. If she had tested positive for it, she'd have to go every 3 months. As of right now, she has no swelling of the eyes, which is great. If she did have swelling or inflammation of the eyes, it could cause blindness, it could cause permanent vision loss, and she wouldn't even know that it was happening until the eye doctor spotted it. The next form is polyarticular. It affects roughly 30% of all children that are diagnosed with JRA. It usually affects the small joints, like the hands, fingers, toes, and it usually affects 5 or more joints. It can affect the weight-bearing joints, like the hips, knees, and if it does affect one knee, more than likely it will affect the other knee, the other hip. It will affect the same joint on one side as it does the other. The last known arthritis is systemic JRA. It's also known as Still's disease. It is generally accompanied by a really high fever that can last anywhere from a couple weeks to a couple months. It's usually 103 or higher. It is usually accompanied by a rash that can be on any part of the body, the chest, thighs. It can also be accompanied with joint inflammation, not always, but the joint inflammation can show up within a couple weeks to a couple months after the first appearance of the fever. Some children with systemic JRA, they'll only have 1 episode or flare-up and be in remission, never have another issue. But sometimes it will go into either polyarticular or polyarticular JRA. The bad thing with the systemic JRA is that with that it can also cause inflammation of the heart, the lungs, the liver, the spleen, if not diagnosed properly. JRA can be some just typical symptoms of JRA. They vary from child to child. It can be difficult to diagnose a child with JRA. Like with my daughter, it took a trip to the doctor, x-rays. It took a trip to the, what was it? It was the, what did I go see? I'm blanking out. She saw the bone specialist, I can't even think. And she did an MRI and an ultrasound, and it came back that it was nothing to do with the bone. Then we saw the rheumatologist. It took roughly 6 months from the first time I noticed swelling to get her diagnosed, which we were lucky. Some children can go months to years without even knowing, And by then, sometimes the inflammation has been there for so long that it causes irreversible damage. The most common symptoms of JRA, with any type of JRA, is joint inflammation, which can cause pain, heat, and swelling, tightening and shortening of the tendons. Joint damage can be caused, again, by swelling that is continuously there. Altered growth resulting from joint inflammation can happen too. Whereas with our daughter, she has one leg that is just slightly longer than the other because she has had swelling in one ankle for 2 years. Again, JRA affects roughly 1 out of every 1,000 children, and it is a disease that is hard to diagnose. They have to do other testings to make sure that it isn't something more serious. And once it's diagnosed, then the treatment can begin. Katie has had it for 2 years diagnosed now, 2.5. And right now she has only one joint affected, and hopefully she will go into remission here soon. Thank you. Done.